So my topic is cardiac cycle. Hello, good afternoon. My name is Dr. Shani Sharkar and I'll be discussing cardiac cycle with correlation with ECG, JVP and heart sounds. So everyone will be knowing this diagram. This is very familiar diagram of ours. One thing I want you to note here is that the duration of cardiac cycle is 0.8 seconds. And the atria and ventricles are acting simultaneously. Okay, so when the ventricles are in diastole, in the later part of ventricular diastole also, atrial systole is taking place. And during atrial diastole, the ventricular systole is occurring. Duration of atrial systole is 0.1 seconds and atrial diastole is 0.7 seconds. Ventricular systole duration is 0.3 seconds and ventricular diastole is 0.5 seconds. Okay. So, and one more thing is that during severe tachycardia, ventricular diastole is compromised. We'll be talking about this in our further slides as well. We will be coming back to this slide. Let us first discuss the cardiac cycles. So cardiac cycles are divided into three phases, three major phases, that those are atrial systole, ventricular systole and ventricular diastole. Ventricular systole is subdivided into isovolumetric contraction phase and the ejection phase. The ejection phase is subdivided into rapid ejection and reduced ejection phase. Ventricular diastole is divided into isovolumetric relaxation and the ventricular filling phase. The ventricular filling is further divided into rapid filling and reduced filling. Now, for NEET PG exam, this slide is of utmost importance. I'm just finding my cursor. This slide is of importance. Okay, so we have to study the correlation of each of the phases with the ECG, the heart sounds, and the JVP. Okay, so the ECG, the JVP, and the heart sound in the phonocardiogram. So let us talk about the first phase, the atrial systole. So the heart, the blood from the atria enters to the ventricle during the atrial systole. Okay, so here the findings are the peak of the P wave in ECG. The JVP shows genesis of A wave in the JVP. Okay, and the fourth heart sound is in the phonocardiogram. Okay, so let us correlate with the slide. This is the atrial systole part, and the fourth heart sound, the JVP, and the peak of the P wave is our findings. One more thing you have to know, the ventricular filling is a passive phenomenon and 80% of ventricular filling occurs passively. Okay, and the rest 20% is the active filling that is taken care of by atrial systole. So in normal individual is not of that much importance, but when the patient goes into significant tachycardia, the ventricular diastole, as I already spoke, that the ventricular diastole is compromised. So in this case, the blood that the active filling, 20% active filling is of major importance. One more thing you need to know here is the atrial kick. What is the atrial kick? It's the extra force generated by the atrium when they contract, which increases the blood flow across the mitral valve. Occurs during late atrial systole. Purpose is to increase the pressure gradient, which increases blood flow across the mitral valve. Atrial kick contributes about 15 to 35%, but when the heart goes into atrial fibrillation, it gets completely lost. As the person ages, it gets closer to 35%. So now we will proceed to our next phase, that is ventricular systole. Isovolumetric contraction phase. So now let us go back to the graph. Here see the mitral valve is closing now. Okay, during the atrial systole it was open. Now it will get closed, and the aortic valve is yet to open. So now the heart is like a closed chamber where the volume is constant, but the pressure is rising. The pressure will be 80 millimeter Hg in the left ventricle, and in the right ventricle it will be 8 millimeter of Hg. So this is the phase of isovolumetric contraction phase. Here we are finding first heart sound in the phonocardiogram, the peak of the R wave, okay, and the volume of ventricle is constant and there is no flow in aorta, okay, and the pressure of the ventricle is rising. So it is the finding in isovolumetric contraction phase. Now we will proceed to rapid ejection phase. So this is the rapid ejection phase, okay. Here you have to note that now the aortic valve has opened, so the blood will rush to the ventricle, okay, and the ventricular volume will rise. No, the atrial, the ventricle, the blood will rush from ventricle to aorta, okay, because the aortic valve has open. Pardon. So the aorta, the aortic, the ventricular volume is falling now. The ventricular volume is falling now, and the aortic blood flow is increasing. The ventricular pressure is yet greater than the aortic pressure. This is the curve for the aorta, aortic pressure. Okay, this is the aortic pressure curve, and this is the ventricular pressure curve. So it's rising, okay, but aortic pressure is rising, but it is not greater than the ventricular pressure, okay, in this phase. And the aortic blood flow is rising, the ventricular volume is falling, and we are finding one more finding, that is the C wave in JVP. Okay, so let us proceed. So one thing is that the first heart sound appeared because of the closure of the mitral valve. Okay, so now the rapid ejection phase. The rapid ejection phase, what we saw is the JVP shows C wave in JVP. There is steep fall in the ventricular volume. There is steep increase in the aortic blood flow. Okay, aortic pressure has increased, but it is still lesser than the ventricular pressure. So that's all about the rapid ejection phase. Now, let us discuss about the reduced ejection phase. The findings of reduced ejection phase are aortic blood flow will greatly decrease, and in this phase, the aortic pressure will exceed the ventricular pressure, and the T wave has appeared in the ECG. Okay, so as I told you that during the ventricular systole also, atrial diastole is also happening. So this is happening at the same time. So the same finding will appear, that C wave in JVP. What is the cause of the what JVP denotes? JVP denotes the occurrence in the right atrium. Okay, so the C wave is because of the bulging of the tricuspid valve towards the atrium, towards the right atrium. Okay, and one more thing is the V wave will start to rise at this phase. Let us see the reduced ejection phase. This is the reduced ejection phase, where the aortic pressure is more than the ventricular pressure. The aortic blood flow has decreased, the volume of ventricle is further decreased, and the appearance of T wave, as we saw in the slide. So now when the reduced ejection phase ends, with that the aortic valve will close. Okay, and there will be appearance of a notch in the pulse. We will see the appearance of a notch, pulse pressure, that is the dicrotic notch. So this is the dicrotic notch. Okay, so now we will proceed to the relaxation phase, isovolumetric relaxation phase, that is the ventricular diastole. Okay, so let us discuss about the isovolumetric relaxation phase. That is, the aortic valve has closed and the mitral valve is yet to open. So between this, heart is again, ventricle is again a closed chamber, and the pressure will fall. The blood flow will stop. In the aortic, blood flow will be almost nil. Appearance of second heart sound will be for the closure of the aortic valve, and there will be in JVP there will be the appearance of V wave. This phase will ends with the opening of mitral valve. Okay, So let us go back to the slide again. So we talked about the isovolumetry relaxation phase. Left ventricular pressure has decreased, the appearance of second heart sound and the appearance of V wave. Okay. So the next slide is the rapid filling phase. So as the mitral valve has opened, the filling phase has started. Appearance of third heart sound because of the rush of the blood in the ventricle. Rapid increase in ventricular pressure and atrial pressure has exceeded the ventricular pressure. That's why the blood is coming into the ventricle, and the last phase is the ventricular filling, that is the diastasis phase. So this phase also coincides with the atrial systole, as I have already told that when the ventricle dilates, the atrial systole also takes place in the later phase, that is the diastasis. Okay, so in this phase again, what we talked about the atrial systole part, that 20% of ventricular filling is active, and that is at most importance when the patient is in tachycardia. Okay, is in severe tachycardia. So in this ventricular filling phase, that is diastasis, the findings are P wave in ECG, and the ventricular atrial pressure will remain unchanged. Okay, so so this is our last phase, and there is the appearance of P wave again, but the peak will be attained in the atrial systole. Okay, so let us come into our this slide. By now we have studied everything. So one thing you have to note here, that this is the end diastolic volume, that is proportional to preload, that comes just before isovolumetry contraction phase. So this is a probable question. And this thing, dicrotic notch, that is the blood briefly flows back towards the heart, and the semilunar valve, the aortic valve, closes. Okay, the pressure drops, but volume is unchanged. So by now, if you study this slide, you will be getting everything what we have discussed so far. So now we come to the relevant MCQs. So mark the correct statement regarding ventricular ejection. So the first is RV ejection starts first and ends first. LV ejection starts first and ends first. Option C is RV ejection starts first, but LV ejection ends first. And option D is ejection of both ventricles starts and ends at the same time. So first of all, the pressure of left ventricle is much more than right ventricle. The pressure where the left ventricle pushing the blood is the aorta is much greater than the pulmonary artery where the RV is pushing the blood. So there can't be both the ventricles can't start and end ejection at the same time. So fourth option is wrong. So let us see the other options. So the RV is ejecting blood into the pulmonary artery where the pressure is 25 millimeter, 20-25 millimeter Ag, and that is much lesser than the aortic pressure, that is 125 millimeter Hg, where the blood goes from left ventricle. So it will take a higher pressure to open the aortic valve than the pulmonary valve. Okay, so RV will start ejecting first, right? And as the pressure is in aorta is much higher, the leaflets will, the time when the leaflets will close first, the time that it will take for the blood flow will be much lesser. So the RV ejection will ends also first, and the LV ejection will ends also first, and so the LV ejection will starts first and it will ends first as well, because the pressure in the aorta is very high. It will take less time to flow the blood, and the leaflets will close. So LV will ends first, LV ejection will end first, and RV ejection will end later. So the option C is probably the it is the right answer because the RV ejection starts first and ends later, and LV ejection starts later but ends first. So C is the right answer. Option number 2 is C wave in JVP is due to atrial systole. No. Bulging of the tricuspid valve. This is very favorite MCQ and it has come multiple times. C wave is due to bulging of the tricuspid valve. If you go through the slide, you will know the answer. That is, it is due to the bulging of tricuspid valve into the atrium. Okay, so option B is correct for number 2. C wave is due to bulging of tricuspid valve. So the third MCQ is during isovolumetric contraction. I already told you in the first slide we have seen that just before isovolumetric contraction is the end diastolic volume. Okay, so here B and D is incorrect because both of these happens in what? In atrial systole. Okay, so number B and number D is incorrect, and so we are left with option A and option D. Is it end systolic volume or is it end diastolic volume? So if we go back to our first slide, you will see that just before isovolumetric contraction comes our end diastolic volume. Okay, that is that proportional to the preload. So the MCQ of isovolumetric contraction is due to end diastolic. This is the in the option C. Option C is the volume of blood in the left ventricle should be equal to end diastolic volume. Okay, so option C is correct. Option E is incorrect because B is incorrect. Okay, A wave in JVP appears in the systole. The fourth heart sound and the A wave in JVP both occurs in the atrial systole. So that's about today's class. Thank you.